Okay, stand by.
Okay.
All right, you ready to go?
Yep, ready to go.
Ready? We're gonna do it in 5. Stand by. 5, 4, 3, 2. Bring down my music.
Malden. I'm Gary Christenson, Mayor of Malden, and we're here on Tuesday, August 25th, 2020, with another COVID-19 update. We're joined tonight by Chris Webb, our Director of the Health Department, as well as Dr. Kourtney Nickerson, who is on our Board of Health. And they've been on previous shows, so I want to say thank you to them at the outset for taking time to be with us again this evening. We also have Malden's Communications Director, Ron Cochran, who will help organize tonight's show. And of course, he can't do that alone. He does that with Malden Access Television. So let me also thank them at the outset. So before we get to introductions, I think the way this will go, we're going to have Mr. Webb talk about where we are today. And Dr. Nickerson will talk about some of the state orders that are in effect today. And then let me segue over to them by talking about city services. If you recall at our last show, City Hall is now open, but by appointment only. We are continuing to encourage everyone to do as much as they can online. Appointments can be set up with the respective department. And the other thing that we've done, and I think this was mentioned at the last show, we now have a ballot box inside the lobby. So anybody wishing to drop off their ballot can do so during the new City Hall hours, which are Monday, Wednesday, Thursday from 8 a.m. to 5 p.m., Tuesday from 8 a.m. to 7 p.m., and we're now closed Fridays. The one other thing that Mr. Webb will touch upon in his opening remarks is, I think on the last show, or the show previous to that, we did talk about some positive test results on West Nile virus. So we're going to get an update as well on that. So without further ado, let's get some introductory remarks. And then, of course, as we always say, the most important thing is we want to hear from you, and we'll turn it over to you right after that. So, Mr. Webb.
Good evening, everybody. Glad to be back again. I find that these meetings or these Zoom calls work very well to get the message out, and it's nice talking to everybody. I do see people out in the street, and it's nice to be appreciated. So I want to thank everybody that says, hey. The numbers for today are cases, our total is 1,386 with 86 deaths. That's one up from the last previous month anyway. So the testing is still brisk. We're averaging 4.2 cases every 14 days on average per 100,000 people. So that's good, and we'd like to see more people get tested. So if you haven't, please do go out and get tested. It does help us decide what we can and cannot let people do. A lot of folks are coming in with great ideas about community events. Some of these numbers just don't allow some of them. So help us out, get tested, and hopefully we can bring those numbers down. I'd like to take this chance just to clarify one point. I had made a comment last night in the Board of Health meeting about going to New Hampshire. I misspoke. The New England states are still viable except for Rhode Island. You can travel to that state and come back. I misspoke. I was trying to make another point. I didn't make either point very well. So if I confused anybody, I'm sorry.
Okay, and Mr. Webb, on the color-coded metric that the state has been recently using, we're still at yellow?
We are, but we're at 4.2. So if we go below 4, we'll be a green community.
And when will we know that, Mr. Webb? When's the next point?
The next update is going to be on that number will be, the last one was the 19th. So 2 weeks from the 19th will be the first week of September.
Okay. All right, very good. Thank you, Mr. Webb. And did you want to add anything about West Nile?
I'm sorry. Yeah, the West Nile virus is here. I don't know how much people have heard about it, but we did have 3 positive test pools in various locations in the city, one in Linden, one up in the Fells Way, and one in Edgeworth. So the Edgeworth one was a little surprising. A gentleman there, luckily, is recovering very quickly from being diagnosed with West Nile, much like having flu. He thought he had COVID, actually. It turned out to be West Nile virus. So we took samples from those 3 locations, as we do periodically throughout the year, and all 3 came up positive. So like most tests, you always wonder about whether it's a false positive, false negative. With the number of mosquitoes that they were able to catch, which was very low, less than 100, we like to retest. So we'll give that, next week will be another retest period, and we'll see if all 3 come up positive again. I don't think that's going to be the case.
Mr. Webb, in lieu of that, what should people be doing? Using repellent, wearing long sleeve?
You know, it's just like any virus, right? We want to stay away from the source, and we want to make sure we're not, attracting the mosquito. So if you go out at night or before dusk, or at dusk or before dawn, wear deep, wear long sleeves if you can, wear pants, no shorts, do what you need to do, and then go back inside or go to a safer place than maybe a vegetated area. Make sure you get rid of all the standing water on your property, which is super important, because the mosquitoes that we're talking about breed in grass, and they love tires, they love bird baths, they love plants, gardens that are holding water, and it doesn't take long for them to breed. It's probably if my memory serves right, it's a 7-day incubation period in the water, and they start to grow like tadpoles. So the turnaround period is pretty quick, and the symptoms are a lot like COVID. So if you're concerned, it could be any number of things. So get tested, and stay out of the yard if you don't have any bug spray. But if you have to, go out, but get right back in. If you're having a problem with mosquitoes on your property too, please report it to us, because we don't have a lot of areas where there are a lot of mosquitoes, and we'll move a testing site to your location, which will help us dramatically with our testing.
And I know, Mr. Webb, on the last show, if you want to reiterate, you don't anticipate us spraying in Malden because of the low count of mosquitoes that were collected?
Yes, spraying is, aerial spraying is for triple E. So we don't have triple E mosquitoes in this community. We have the Culex pippins, which is a ground type mosquito that does breed, does contract West Nile virus. They bite birds more than they bite people. It's occasional that people get West Nile virus. Mosquito gets confused and bites a human. So we would like just, folks to pay close attention to that. I'm sorry, I forgot the rest of your question. I'm just too many Zoom calls today.
Yeah, no worries. Just want to let the community know you don't anticipate the state coming in to spray the community.
No. Aerial spraying for Eastern equine encephalitis, and truck spraying is not real effective with these mosquitoes either. Like I say, they're lower. Truck spray tends to go up into the trees and then dissipates very quickly. So it doesn't have a great kill rate. The best solution we've seen in this city is using larvicide in the storm drains, which we do twice a year. And we have reduced the population. I can remember when we first started this program, we used to put a trap out for half a night, a couple of hours. We'd get 30,000 mosquitoes. We can't get 100 after leaving it out 24 hours. So our population is down. The risk of West Nile virus is low or moderate right now in our area, but you don't want to take the chance. It's not a pleasant experience. It can be achy, painful experience. So we really believe that I know everybody remembers the truck from when we were kids, and I can remember it, but it's just not effective with this type of mosquito.
All right, very good. And Mr. Webb, before we forget, if someone has a question that they're not able to ask tonight, what's the phone number and email to reach you and your department?
My phone number is 781-397-7049, and my email is cwebb@cityofmalden.org.
All right, thank you. Dr. Nickerson, the floor is yours.
Good evening, everybody. Thank you for joining us tonight. It's nice to check in with everyone and hear how you're doing and what concerns are on your mind. I'm proud of everyone for keeping up with the PPE and all of the precautions that we still have in place. I know that it's making life very difficult. And I do want to remind you that we are still in step 1, phase 3. So the governor wants us to make sure that we're maintaining our outdoor gatherings to 50 people or less, and really no crowds if necessary, because we're going to keep this virus from spreading if we can minimize those crowds. And then indoor gatherings, really 25 people or less. And it's on us individuals to make sure that we're doing the best, putting our best foot forward to keep these gatherings and stuff getting down. Sorry, mumbling over my words tonight. And then when you're outside, wear your face coverings, please, especially if you're with groups of more than 10 households that are mingling. So we've got a lot of tools in our arsenal to stay protected from this. We're doing a good job. We just need to keeping up.
All right.
Thank you.
All right, thank you. Let's get to it, Mr. Cochran. We're going.
Yeah, sure thing. We actually don't have our phone calls queued up just yet, but we're waiting for folks to dial in. We are looking at our other channels here. We just always like to remind everybody how they can reach us. So I am actively looking right now at our Facebook page for questions. We've got a couple queued up, which we'll get to in a minute. I also look at our YouTube feed, which is Malden Access Television's YouTube feed, and I look out there for questions. And of course, you can always email info@cityofmalden.org. And with that said, we would like to just actually go to our first question, but we do have some information that we'll get later in the show. We do want to remind folks about some city-related things, such as voting. So why don't we do a question first, and then we'll circle back around and I'll talk about voting. If that's okay with you, Mr. Mayor?
Yeah, sure.
Okay, our first question is from, let's see. Our first question is from Eden. Eden asks, is there any information on upcoming flu clinics? What ages are allowed, and is there any other pertinent information?
All right, let's have both of you respond. Let's start with Mr. Webb. What's the latest on when you think we might have the clinic?
Well, we're always hopeful that we'll get flu vaccine by October, because that's the optimal time to start your flu clinics. But we haven't gotten, with the new guidance from the state for school-age children to be vaccinated, basically everybody under 18 years old. Some of the meetings I was in today, those long-term plans aren't really available yet. The state hasn't really figured out how they're going to deliver on the vaccine, or if they're going to deliver on the vaccine. So we're trying to work those details out. Barring that, which is a huge obstacle, we're still planning the clinics. We're actually going to go with mobile clinics this year, or drive-throughs. It likely would be at the Salemwood School under the field house. And we anticipate we're going to use flu season this year to do more like family clinics. We'll have a family day where if you have children in school or school-age children that need a flu shot, you can come down as a family. We'll vaccinate the entire family. And then maybe the next day, which will probably be a Sunday, we'll just go to a regular open clinic and have, a bunch of nurses on hand. We're hoping to do 3 cars at a time. That's the current plan. It may drop down a little bit to 2. I hope we don't have to get to 1. I'm hoping we can do 3 at a time and really move the line along and give the people the information and services that they're looking for. There are no dates yet. We don't have times, but we do believe that we're going to try and do them on Saturdays and Sundays so that we can put in a good 10-hour day and get as many people through as possible. And if the lines hold up and we have enough vaccine, we'll stay as long as there's people in line.
And Mr. Webb, you're anticipating that being at the Salemwood School, correct?
Yes, it really is the best place for it. At least we have some overhead protection for staff in the vaccines, and it has a nice traffic pattern. And there really is no reason why anyone would really, and if anybody needed to get out of the car, it's a great place. You can walk up, use the restrooms, get back to your car. We can manage that. So it's a safe way. So it really is optimal.
And did you say, Mr. Webb, it's not a matter of if, it's a matter of when we're having the clinic?
Absolutely. Yeah. We're definitely going to have clinics. We're going to have multiple. I do believe, I would, ask people to, if you have a primary care physician, talk to them now, because a lot of this stuff is telehealth, and you're going to want to see what your doctor is capable of doing. Is he going to be bringing people in for flu shots? If not, then, you might want to keep a good eye out for our schedule, and, get in touch with us if you feel you need to, and we'll keep you up to date either through email or through the city website or social media.
Okay, if you haven't noticed, one thing about this new city hall, it's very energy efficient. So I'm gonna have to get up and turn the lights on. While I'm doing that, let's have Dr. Nickerson talk about the importance and your thoughts around the flu shot. I mean, there's been a lot of debate still about whether or not, it makes sense, particularly with what's going on. What say you?
I strongly believe in the flu vaccine. I think that it's extremely beneficial to everybody to protect themselves and their loved ones around them. The flu is nasty. It takes you out for a couple weeks. It's uncomfortable. You're miserable, and it's easily spread. So even though the flu doesn't protect you from being sick, it does shut down the course of disease so that it's much shorter, and then you're back to normal much faster, and then you're not infecting those around you. It also protects you from heart-related events, which I just learned recently. So a couple benefits to getting the flu shot that we might not have appreciated previously. And then to echo what Chris was saying, is we've been working, the department's been working very hard to make sure that we have enough vaccines for everybody. Keep your eyes posted for when those clinic dates will be, and also check with your doctor, check with the local pharmacies as well. They will have vaccines available. We want to make sure everybody gets what they need.
All right, very good. All right, Mr. Cochran, who's next?
Well, before we get to that, I'd like to go over our voting information. I think it's important for us to let our residents know out there, not necessarily COVID related, but certainly important nonetheless. Our city clerk's office, led by our city clerk, Greg Lucy, has been hard at work, probably harder than ever. I think you would attest, Mr. Mayor, just about the busiest that they've ever been with mail-in voting. So I guess, yeah, it has a tie to COVID. So why, mail-in voting was made available, and they're awfully busy over there. But we do want to let folks know that at our website, cityofmalden.org/vote, we have complete, thorough information. I'll just go over a couple of quick dates and times and things, and then we'll invite residents to go ahead and visit the website. And the first is, what are the dates? So we have a state primary coming up on Tuesday, September 1st. That's coming up this coming Tuesday. So it's right upon us. And then we, of course, have our general election, which includes our presidential election, and that's Tuesday, November 3rd. Those elections can be voted in by a number of ways. There's in-person voting, there's mail-in voting, and then, of course, there's a traditional absentee ballot voting. All of that information is available on our website, like I said, at cityofmalden.org/vote. And then one very exciting addition to this website is it is now translated into 6 different languages. So when you visit cityofmalden.org/vote, you will have the ability, if you speak that native language or read that native language, to view it in Chinese, Haitian Creole, Portuguese, Arabic, Spanish, as well as Vietnamese. So we're very excited about that. So we do encourage our residents to visit there. And then last but not least, all of these dates that I mentioned are going to be posted to our city calendar. So if you go to our website and you look at our city calendar, we will put all of our election related dates in that calendar to make it easy for you to track.
Okay, and early voting?
Yes, early voting dates will be listed there. It's probably worth mentioning that our early voting for the, for in-person early voting for the state primary will be held August 22nd, which has already happened, has already been a session, August 22nd through 28th. In-person early voting for the general election will be October 17th through 30th. The location for in-person voting will be at the Senior Center located at 7 Washington Street. And that's Monday, Wednesday, Thursday, 8 a.m. to 4 p.m., Tuesday, 8 a.m. to 7 p.m., and Friday, 8 a.m. to 12 noon. I'm going to double check on that. I want to make sure those hours are correct. That might be a tweak, but like I said, we are going to refer folks to cityofmalden.org/vote for that information.
It would be 8 to 5, right? Just check that.
That's what threw me off, because I think this may be lagging with our new hours, but I'll go ahead and make sure that gets verified and corrected if necessary.
All right.
But again, cityofmalden.org/vote. Sure. So our next question comes from Diane. Diane asks, or she would like to know, where can she go for testing if she is asymptomatic? And then the follow-up to that is there a charge for testing?
Okay, Mr. Webb.
Well, second question first. It depends on where you go. Most of the vendors that we recommend will take insurance if you have it. The average cost for a shot is the test. I'm sorry, can be expensive. Can be over $200. So the City of Revere has a site at the Revere High School at 101 School Street. Monday, Wednesday, and Friday. Monday, Wednesday, Friday, and Saturday, 7 a.m. to 11 a.m. And Tuesday and Thursday, 3 p.m. to 8 p.m. That is a walk-up clinic. But if you'd like, you can call 617-745-9999, and they'll be able to answer any questions you have. I would recommend that, or if you have insurance, CVS at 1080 Eastern Avenue is also taking appointments. So give them a call and they will get you in. I've been hearing great things about their service.
Okay, and what about the former question? Asymptomatic.
Is there a charge? There are no charges at the two clinic. The CVS is insurance. If you have insurance, they'll take it, but there is no charge. And same at Revere, there is no charge.
And I'll add to that too, is if you're asymptomatic, it depends on the testing site. So if you go to Stop the Spread on the mass.gov website, you can find all the testing sites that I don't think require you to be showing symptoms to go get tested. And there's a lot listed there. And then again, so the same rules apply, whether or not you have symptoms, or if there is a fee, or if you need insurance. So there's quite a list.
And that's mass.gov. And then what do? Do you put in the search bar, Stop the Spread, or is it right on?
I think it's right on the front page, because it's under the coronavirus testing options. One of the options is Stop the Spread. And I think that's aimed more at the preventive testing. So if you think you might be asymptomatic, go get tested through that mechanism.
All right. If Diane, that all fails, don't hesitate to call us tomorrow or the next day, and we'll see if we can help you out.
And I'll always advocate for the website as well. We do have quite an extensive selection of information on our website, cityofmalden.org/COVID-19 or cityofmalden.org/coronavirus. Either one will get you to the same place. And there we have listed a bunch of information, including the latest numbers, resources. And one of the resources in particular that we just added last week was a interactive map that shows you different testing sites that are around you. It's probably the same one, Dr. Nickerson, that you're referring to. I think we just linked to it. And it's a very nice way to see what is around you so that you can test. And actually, we can get into that, because that's one of the questions that was asked. I guess maybe we can be redundant here and ask, what are the sites in Malden that are currently doing testing?
Okay, Mr. Webb.
Right now, the only ones in Malden are the CVS at 1080 Eastern Avenue and the one at Ferry Street. I don't know the address at Ferry Street, but both are call the store first for an appointment. They're appointment only locations. You do it through the drive-through.
Okay, so Ron, maybe at some point you can Google the phone number to CVS. I don't know if the stores have different phone numbers, but let's try and provide that to the public, unless Mr. Webb has it.
I don't have it on my chart for some reason. I should, but I don't.
All right, we'll have Mr. Martin dig that up.
Yep, sure. I've got that right here. It's CVS 32 Ferry Street is 781-324-1101. CVS 1080 Eastern Ave, 781-322-5890. And I'm sorry, did you say all three locations, Chris, that we're doing
just those two.
Okay. All right. So there you have it.
All right. Thank you, Diane.
Okay. Our next question comes from Mary. Mary asks, she's asking if we can get rid of street sweeping during the pandemic. She said it puts more stress and anxiety on Maldens. Please consider, removing those restrictions.
Okay, we had at the height of the pandemic, but I think, once the numbers started to come down, we really, I think, had to get back to trying to make sure that, we keep the city clean. So I don't know if Mr. Webb or Dr. Nickerson, you want to add to that, but most cities around us, I think, have restarted their programs as well.
Yeah, I guess my question is the frustration from finding parking or the concerns? Because I think street sweeping is very important right now, especially with some of the issues that we've got with some of the neighborhood pests as well.
Right.
So I think that's an important program for us to keep in place. But if you can let us in on what your major concerns are, if you're having trouble with parking or if there's something that I'm missing, then maybe we can help address and make that less stressful for you.
Yeah, so Ron, maybe you can drop the phone number to the parking department and have the customer call in tomorrow.
Will do. We will certainly follow up with them. Okay, our next question is from Pete Casso. Pete asks, when you get the flu shot, how long does it take to actually affect the body? Some say it's 2 weeks.
Yep, it'll take up to about 2 weeks for your body to mount an immune response. So that is to familiarize itself with what it saw in that vaccine and then be ready to fight it when it sees it again.
Okay, Chris, you want to add to it?
No, that's a very simple explanation. It's exactly how it works.
Okay. All right, Pete, thank you for that question. I know that will be on All About Malden tomorrow on Facebook. So thank you for helping us get the word out.
For sure. Our next question is, I think it was in response to the West Nile question, which is at the beginning. And that is, if a person is looking for information on West Nile virus and they don't speak English, is there information available on the website? I have the answer, but I'm going to kick it to you, Chris, first, if you'd like to respond to that.
I know that we're working on updating all of our web pages with multiple languages. I have not searched the city website. I spend most of my day on the Mass DPH website, but I'll let you answer that question for the city website. But the Mass DPH website actually does have languages for frequently asked questions and things like that related to West Nile virus. They have, I believe, 9 languages.
Okay, Ron?
Yeah, for us, it's lucky for you, Chris. You have some extremely talented employees there, and one of your employees, Peter, was right on top of this, jumped out in front, and we went ahead and had that information translated into those same 6 languages. So if you visit our website, quick, easy link for you, cityofmalden.org/West Nile, one word, West Nile. And that has information, basic information about West Nile, and then of course those same 6 languages. And what you're going to start to see on our website is anywhere we have this critical information that we know needs to get out to our English language learners or non-English speaking people, we do need to make sure we provide that information. And you'll see those same 6 links that are available to them. And it's listed in their own native language. So it's not just the word Chinese, it is the word Chinese in Chinese. That is the word Haitian Creole in Haitian Creole. So it makes it real easy. It's right in your face. It's the first thing you can click on.
Okay, thank you.
No problem. Okay.
I'll buy Peter lunch.
Definitely.
Definitely.
Split it with him.
Ron, no phone call tonight?
We are still waiting, but hold on, actually. Oh, okay. We do have a phone call online. This just came in. We have Nestor on the phone. Nestor is on the phone. Go ahead. You are on the air with the panel.
I just want to say good evening, everybody. And first of
Nestor?
all, yes, this is Nestor. This is the Nestor. This is the Dudster. So, can you hear me?
Okay, well, maybe we'll let
Can you hear me?
MATV work. They might be having some technical difficulties. We'll let them handle that, and we can certainly move on to another question. Our next question is blood donation during COVID. And it's, is it safe to donate blood during COVID-19?
Okay, who wants to take that?
I'll
first?
take that one first. Yes, it's not only safe, it's imperative. People are walking around with antibodies, and there is some evidence, it's not conclusive, that plasma from people who were past positive may help some people recover quicker. And if nothing else, there are still car accidents and horrible accidents happening every day, and people need blood. There is a drastic shortage, and I would recommend that you go. The Red Cross, I know the mayor and I often see each other at blood donating. It's weird, we just end up there at the same time all the time. I don't know why, but they have it set up so that even before COVID, they were always aware of cross-contamination and universal precautions. So they've just enhanced that, if you can imagine. So it's very safe, yes.
But you really have to book in advance. I know Maria
Yeah.
Louise told me we did one at the senior center recently with the Y, and they were, for lack of a better word, sold out within hours of announcing. So that's a good sign, but definitely call in advance. So Dr. Nickerson, you agree, I presume?
I do agree. Chris, do you know anything about whether or not you get results for your blood if it is screened, if you have antibodies?
I think they do let you know. I haven't been to a clinic yet. I know that Pastor Whitstone has had one recently at the Church of the Nazarene on Eastern Avenue, and he hadn't heard back either. Someone in our group had asked him that question. He didn't talk. He hadn't heard from anybody that gave plasma. So I don't know.
Let's stay with this for a moment. What are your thoughts on what the president announced on Sunday night? Do you think it has a chance? It could help? You want to start with Dr.
The plasma?
Yes.
There have been instances where it has worked, and there are instances where it hasn't worked as well, and then there's instances where it hasn't worked at all. I think it's a therapy that should be considered for the right patient. That, you know, someone who's gotten all the other therapies and still isn't really turning the tide. I wouldn't, because of the shortage of plasma, I don't think it's a therapy that is going to be used a lot, simply because they can't keep that much antigen-laden plasma in stock.
Right.
So this is a really interesting time to be a scientist because there's so much information being generated very quickly. And I think there's a lot of potential here. We're exploring new therapies all the time. Like Chris was saying, people have responded, people have not responded, and there's been a range in between. And I think we're starting to learn that maybe getting antibodies to somebody with a very early infection might be more impactful than later, before that your body has really started to respond to the virus, because a lot of times you see symptoms like with the common cold, that your runny nose is because your body is trying so hard to fight that the virus and get rid of it. So here we might be seeing a lot of the symptoms due to just your body trying so hard to fight the virus. And at that point, it might not be as effective. So we're learning more and more each day. I don't want to spread any misinformation because there's just so much that we don't know still. But it does have potential, and it's exciting to hear that we've got new tools to potentially help people recover from this.
So, Doctor, based on that, I know some people have asked, okay, he makes the announcement Sunday night, now what? Like, what are the logistics around that? Can you now make an appointment? Like, what happens from here? Is it available?
That's a great question. I'm not sure.
Yeah.
We'll go with that answer. I know that our doctors are very, very well trained, that they are up on the literature. MGH has done a phenomenal job of keeping the literature, which is how scientists communicate information with each other, available and translated so that everybody can understand it easily. And I know that they are constantly evaluating their standards of care to make sure that we are delivering the best care to the patients. So I would have a lot of faith in our doctors right now, just because they are working so hard. They have trained for this. They understand how quickly diseases can change, and they're always looking at the big picture, exactly what's happening within each individual patient, and being very dynamic with those therapies.
All right, very good, thank you. Okay, back to you, Mr. Cochran.
Sure, we're going to head back to the phone lines. We had Nestor call back in. So Nestor, go ahead. You are on the air with the panel.
Good evening, panel. Am I through now? Can you hear me now?
Good evening, Nestor.
Oh, good evening, Mr. Mayor. How you doing? So this
All right,
is just
this
a
might
general.
be doomed here for Nestor's
This is just a general follow-up
question.
from what.
I'm going to do our best to get him on the line.
Okay.
That's okay. Well, we will moving on because we do have other questions to answer. Next question is, if I'm exposed to COVID and I get a negative test result, do I still have to quarantine?
Good question. Mr. Webb?
No is the answer to the question, but if you know that the person that you may have contracted it from, and you know that you've been in close contact, and close contact is defined as being within 6 feet of that person for more than 15 minutes, then you probably, you're considered a close contact, and you probably want to at least give yourself 72 hours to make sure you don't become symptomatic from the time you were with that person to 72 hours out. Tests are good, but they're not fail-proof. So in that brief information, that's the way I would recommend they go.
You want to add anything, Kourtney?
Yes, and if you test too early after being exposed, you have a higher chance of getting a false negative as well, because you just don't have enough virus for the test to detect. So it's unfortunate that there are so many logistical challenges in getting tested and what your results might mean, but I would keep all of these things in mind when you are deciding whether or not you should quarantine or get tested again.
All right, very good. All right, Ron?
Okay, our next question is, cities around us are making masks mandatory. Is this something that we should be doing?
Okay, Dr. Nickerson, looks like.
I thought the governor had made them mandatory, but maybe that was wishful thinking on my part.
I think it's mandatory conditioned on social distancing.
There you go. Okay. So yes, if you can social distance, then I think you do not have to wear a mask, but it's, as we've talked about this in the past, circumstances change really fast. You could be out for a walk and come upon a group of people or your neighbor or something very quickly and be scrambling to protect them and yourself. So wear your mask if you're outside. Please take responsibility for yourself, and show how you care for your neighbors by stepping up, wearing that mask.
Okay, Mr. Webb, you agree?
I agree wholeheartedly. Yeah, it is mandatory except it's mandatory unless you can't socially distance. If you're socially distanced, of course, you don't need it. But if you're outside and you think you're going to interact or pass in someone's jet stream, whether they're wearing a mask or not, I would recommend you have a mask on. We don't know when the next surge is going to start, and it could have started yesterday, and we don't know that yet. So at any given time, the incidence of positivity could rise before we get a measurement. So you always want to have a mask on.
Yeah, and I think, Ron, just being practical, we have considered it on multiple occasions and just have concluded we haven't been able to figure out just how it would be enforced. I mean, with everything going on and everybody doing everything that's required of this pandemic, we didn't think we had the capability to do it effectively. If we were going to do it, we'd want to be 100% in on it. And we just haven't found a time that we think we could do that. Now, if the state offered to come in and provide additional resources than we thought, but because we're in that yellow category, they don't think, that we're quite there yet. They're steering most of their resources, as you can imagine, to the communities that have the color-coded metric of red. And so, that's where we are as of today. So
I don't know, do we have that list of where we of mask resources from last week or 2 weeks ago? Maybe we can retweet those or something to share if people need help getting masks.
Yep. Do you want to offer that up, Mr. Cochran? Malden Neighbors Helping Neighbors, Glenn Cronin, Emergency Management.
Yep, we can definitely do that.
Okay.
Next question is, if you test positive for COVID, is it possible to then, if you get COVID, not just testing positive, but you're confirmed that you have COVID, what are the chances that you can get COVID once again after you've completely healed from it?
Chris?
Well, there's recent reports, unconfirmed reports of people in China and UK becoming positive again. Now, I don't have enough information of what that second positive means or why they would test again. I think in the UK cases, they were ill again. They had the same symptoms, went to the doctor, were checked for flu, but didn't have flu. Then they were checked them for COVID and they were positive again. That was just 2 cases so far out of all the cases in the UK. And I think there's a little more work they need to do around that because what if they don't know if those people are infectious either? So there's a little bit more work to be done on that.
All right, Kourtney?
So this is early data. We don't have a lot of information at this point. We don't have a lot of people that we know are getting tested after they've been exposed. So we just don't have a lot of information to draw conclusions from. I think one of the articles that I read said that I believe it was the individual in China, that their symptoms weren't as severe. And that was very promising because it showed that the body's immune response was doing exactly what it was supposed to curb the severity of the illness. And that's exciting news for us as we start to think about what vaccines might be available in the next year. But again, small data sets, really, really limited information. We don't like to draw conclusions just based on how two people respond, especially when they have such differing phenotypes. So I wish I had more positive news to tell you that it was a one and done. We just don't know yet. I'm sorry.
Okay, thank you. Back to you, Ron.
Sure. So Nestor tried to get back to us in another way because of the technical difficulties that we were having. And it was more of a comment, general information, that he and his son had done the Revere High School testing that Chris made reference to, and that stopped the spread, also that Dr. Nickerson referred to. It is a no cost, no insurance, and no appointment needed test site, 1 hour wait time in their car, and they received their negative test results within 24 hours. They said you must provide an email address and a phone number, presumably, to get the results.
All right, thank you, Nestor, for that.
Yeah, that seems like a pretty streamlined process.
Yeah, we're getting good reports out of that one.
Okay, great. Our next question is, I noticed that the stats, that there are a number of quote unquote recovered cases. Are these people that have actually had COVID and recovered, or were exposed and just needed to be quarantined?
Okay, Mr. Webb?
I believe it's both. It's actually both. There's very little contact with the patient after the diagnosis. Most people are home quarantining. So once that 14-day period is up, they're considered recovered. So if you're quarantining and your 14 days is up, you've recovered. If you're positive and your 14 days are up, you're recovered.
Without being tested again?
Without being tested again, yes.
Okay. You want to add anything, Dr. Nickerson?
No, I don't have much to add, but I do appreciate how confusing some of these stats are, because, what does it mean? And why are some people asymptomatic or have recovered within a couple weeks, and other people are debilitated for months or not recovering at all? So this is a tough time, and the numbers are a little bit intimidating. So great question. Thank you for asking.
Yeah.
Okay, I think it probably bears going on to a deeper level about the vaccination, because it's a question that we always get. I know you just did touch on it a little bit, Dr. Nickerson, but what is it? I'll sort of summarize, because I hear a lot of these questions, and that is, what is it that is it a race to the finish by the different drug companies? Is it more of a collaborative thing? And does that make it difficult to actually predict when the vaccine will be available? Or is it more about how the clinical trials are proceeding and the reaction? Like, is there some threshold that needs to be met? And that's why it's difficult to put a pinpoint on it.
So I think it's the way it's supposed to work is the clinical trials should give us the information that we need to determine if a vaccine is effective and well tolerated, so it's safe for people to take. We've got a lot of different, this is really, you've heard the term over and over again, this is unprecedented times. We've never seen so many different people working towards a successful vaccine before. This is really an incredible time. So many different creative approaches, and everybody's efforts are focused on what is happening with coronavirus, how is the body responding, and what can we do to improve outcomes. So you do see there's a lot of money involved. There's a lot of pharmaceutical companies with a lot at stake, but ultimately the common goal is to protect the people. So I might be a little naive here, but I do think that there is a very nice, robust system for evaluating vaccine efficacy, and that is through the clinical trial system. So it's disheartening to hear that it takes a long time to get results from that, but that's just to make sure that over a year's time, these vaccines aren't going to cause debilitating effects. So we want to know that what we're putting in our bodies is safe. And that's why there's so many concerns about vaccines, because there's so much unknown. And here we have a brand new virus. We don't even know what's going to happen when it's been in the body for a year, let alone how would a vaccine, how would your body handle a vaccine for a year? So it's good that we don't have a vaccine available yet, because it means that they're doing their due diligence, that they're moving through the steps of the validation process for determining if a vaccine will be well tolerated, safe, and effective. And we're going to start to see some of that data come out in the next few months, and we'll be able to determine some of that. I think I believe it was the New York Times. I know that there are several websites that have vaccine progress trackers, and they'll take you through the different companies, how they're working on their vaccine, and what kind of data is available out there, so you can start to evaluate them from the information that's made public.
I don't know how you add to that, Mr. Webb.
Not at all. That covered it well, I thought.
Yeah. All right. Mr. Cochran?
Well, there's one more follow-on, and this is one of the other common ones that I get is, so here we are, let's say we have a vaccine, I'll just pick an arbitrary date. We'll say, February 2nd, just because that's Groundhog Day, and that seems to be appropriate when a vaccine would be made available. But say it's February 2nd, what is then the time horizon for how these vaccinations, and I know it's probably difficult to answer because you need the people to get vaccinated, but given the scale of what we're seeing, what do you think the time horizon when you start to see the precipitous, downfall of these COVID numbers after vaccine takes shape?
So that's really difficult to predict, but whenever the vaccine is made available, I imagine that'll be kind of the turning point. And then the question is how well prepared were they for their vaccine to be successful? Because if they really go all in, then we'll have a lot of doses available up front in theory, and then that should be made available to the public. But I think it's all going to come down to planning, availability, how they determine these things should be distributed, and then the public reception as well. So we need to the data needs to be there. We need to have support. We need to support that they're going to plan appropriately. I think this is really tough to speculate. So I think we can appreciate how many moving parts there are to actually getting it into our hands. But if the data is there to support that the vaccines are safe and effective, then it will make its way to us eventually.
All right, Mr. Webb?
I would say that given, if it were ready to go on February 2nd, realistically, just knowing how the federal government's strategic national stockpile works, it will take a goodly amount of time to get it to the local level, the Malden level. You'll get a lot will go to the military first. Some will go to other countries first for the obvious reasons that we don't want those people coming back and infecting us. So there's a little bit of that. And hospitals will get it first, then doctors' offices, and so on and so forth. But the distribution scale is larger than they've ever had to do before. Flu vaccine, H1N1 is a good example. When H1N1 was here, we had a clinic and we did 2,000 vaccinations in a day. And we hadn't done 200,000 vaccinations in a day since I was a young inspector, and we had flu clinics at 630 Salem Street, and the lines went down the sidewalk. It's possible, but I want people to be cautiously optimistic about the announcement of an approved vaccine and when it's going to get to them. It could be realistically months. I'm going to say at least minimum 4 months. And that's if they're really pushing hard to get it out and they're planning now. That's why this office is planning now, because when they announce that it's ready to be shipped, we have to be ready to receive it. If we aren't, we're going to go to the back of the line. And I'm not going to the back of the line for anybody. So that's our goal. That's really our goal. We're fully anticipating that tomorrow they're going to call us and say, we're ready. So I don't really follow the vaccine. I'm waiting for DPH to tell me which loading dock you want it at. and we're going to be ready to receive it.
All right, very good. All right, anything else in the queue, Ron?
Yeah, we're going to wrap up, I think, with this one last question, because as always, I like to leave just a couple minutes at the end of the show for folks, our guests, to say a few closing statements, and of course you, Mr. Mayor. So our last question is about high school sports. As it stands now, will there be high school sports? I guess they're probably talking about the fall, but I guess we could probably talk about ones even beyond. Will they be permitted? And is that a statewide mandate, or is that at the local level? And if you could just elaborate.
Okay, Mr. Webb?
I think high school sports being controlled by the MIAA. The MIAA is working with DPH and the Department of Education to make the best choices and decisions based on data. Right now, where we have this color-coded metric system, red is a lot of red communities are right around each other, especially in our area. So to promote, well, let's say just Middlesex League, to promote Middlesex League or Suffolk, any leagues in the Suffolk County, you really wouldn't be able to manage those leagues. And that puts a lot of kids in those sports out. And it shuts down interleague play, so you lose more games. I think that's why MIAA decided to suspend football. You're just not going to get enough games in. And it's not fair to the kids to have them go through the typical training camp under tougher conditions than normal and then get out to play only a couple of games and no championship. And because you can't have a tournament. So do I think long-term that will change? Yes, I do. I think we're going to get down to a point where everybody's either green or white, and we can then push those boundaries a little bit more. And that's why I'm always harping at people, get tested, because the more numbers we have, the more negatives we have, it drives down our positivity ratio. And then we get to expand on what we can and cannot do. We're better informed. So I think when we get to mostly green and more whites, we'll probably see maybe hockey, maybe the winter leagues will be able to do it, because hockey's a little, there's contact, but it's not typically one body on top of another. It's quick intermittent contact. So sports like that, I think, will come. And then coming into the spring, the spring sports, I think, will stand a very good chance. You might see a modified play a little bit, shorter period, something like that. But as long as we keep driving the number down, again, the more things we'll be able to do.
All right, Dr. Nickerson?
I think Chris covered it nicely. Yep. It's a tough call, but ultimately safety of the kids.
Yeah, I do want to take a moment just to thank our high school athletic director, Charlie Conifrey, who plays a big role in the MIAA. And they've been able to come up with a plan where winter sports will have the opportunity, fall sports will have the opportunity to come together in the spring. So essentially, they've been able to push the season off without it impacting the other sports. So now we just have to see whether or not, we take advantage of that. But, they have thought long and hard about trying to find a way to save the fall sports. And I was also impressed to hear Mr. Conifrey state that safety will be first. He will have no hesitation on canceling as much as we don't want to if it jeopardizes the safety of our students. So I would just, Ron, let them know to stay tuned. There's a lot of moving parts right now, but we can assure them that Mr. Conifrey, has our back and our students' backs on this.
Okay, fair enough. And it was our final question of the evening. So we want to kick it over to our guest tonight for some parting thoughts.
Okay, Mr. Webb.
Again, I'm going to beat that drum like I do every week. Please get tested. Please get tested. Please get tested. Again, the more negatives we have, the better information we have, the data will support us being able to do more things, and maybe even reduce the amount of time you have to wear a mask, possibly, not definitely, but possibly. That will allow kids to practice a little more than sports like they're used to doing it, things like that. Dining out will probably become a more pleasurable experience when you're comfortable knowing that the positivity rate is down and the likelihood of transmission is less. So get tested, please get tested. And when flu vaccine comes out, please, I know a lot of people have their feelings about influenza vaccine. It makes you sick. It's not making you sick. I can assure you it's not making you sick. You were going to be sick anyway. It's just the timing of the shot. The only thing you're going to get from a flu shot is a bump on your shoulder. That's usually the worst reaction, maybe a slight headache from the pain. But get tested. As Dr. Nickerson said, it's a very important data has come up showing that COVID-19 has an adverse effect on the heart, while influenza vaccine helps support and deny COVID that effect on your heart. So, play like practice like you play, as they say, that you get the equipment you need and get out there and do the best you can. And I don't think you can do that without a flu shot this year.
Okay, Dr. Nickerson.
Yep, let me echo that again. Please go get your flu shot. We're going to try to make it easy for you. Multiple pharmacies in Malden. Call Chris's office and get the information about when they're going to do their flu clinics. We want you to be safe too. Please wear your masks, wash your hands, practice safe social distancing and small group activities. And then one other thing I want to mention tonight is that we have a new list of resources on the Malden website pertaining to mental health, because I know this is tough on everybody and it's really draining. And I know families are struggling, parents that have to suddenly keep their kids home while they're trying to work, in addition to people with substance abuse challenges. So please go to the Malden website, check out those list of resources, and don't be afraid to reach out. We're here for you.
All right, very good. And on behalf of the panel, I think you've heard me say before that I've always considered life to be about hard work and dedication, whether it's school, it's job, taking care of your family. But I also have to say it applies here. We just have got to keep working hard and dedicating ourselves, as tedious and monotonous that it might be at times. It's the only way. So please continue to do what you can to slow the spread, and let's get through this. So on behalf of everyone, thank you for tuning in, and we'll be back to see you soon.